Okay, so pardon the slightly awkward setup, but I don't have a cameraman for today, so it's harder for me to get to where I need. I have a piece of wood. It is a 2x12, I believe, that is bolted into my wall that allows me to put several hooks to set up some bands. I did this because I have worked with these bands in this setup at outpatient therapy gyms, and because of that I've really enjoyed the quick adjustment and the ability to have it in a central location within my gym. I do have my 2 mirrors on either side of this, so it does allow me to have a little bit more visibility to make sure I can correct what I'm doing as I'm doing my exercises. That being said, these usually come with a attachment that allows you to put it in a door. This is an anchor for TRX cable, but it's always something similar to this, that you put it in your door and that then close it tight, and that keeps it from pulling out on you. You generally want a door that's going to open to the inside away from you, because then you're pulling the door further shut rather than trying to put pressure on it and opening it. But again, you know, my setup is not like that, so I don't have to worry about that. I'm going to show today a few exercises that I like to do for postural strengthening for the upper body. So your thoracic spine, scapular posture, those kinds of areas, because we do tend to hunch forward. I have bars in my spine, so this is me slouching. But if you look, you can see the outside of my shoulder that should be underneath my ear is slightly forward. So when I slouch, I round my shoulders forward. I also tend to have slightly, we call it winging scapula, so when my shoulder blade kind of sticks out from my body. So those are 2 things that I need to really work on fixing. And so ideally, I want to be able to keep my posture in a more neutral, which is hard for me, stance, which allows the outside of my shoulder to be in line with my ear and then in line with my hip. Okay. There is also going to be a natural curve through our upper back and through our neck. May vary from person to person, but we don't want an excessive amount of curvature. As we get older, there are some bony changes that happen and we can't fix those, but to the best of our ability, we really want to work on improving those postural and strengthening muscles. So today is going to be at least the postural exercises. I may or may not address some of my rotator cuff exercises. So I'm going to start with postural either way. Posture is really an important thing. I mean, it's in general important for everybody. We all have postural issues. We all need to work on our posture. Postural strengthening exercises are important universally for everybody. They, especially the upper thoracic and shoulder blade region, that posture, I typically will include those postural exercises for anybody that has problems with their shoulder of any kind, whether it's a rotator cuff tear, rotator cuff impingement, shoulder replacement, frozen shoulder, it doesn't really matter. Universally, you know, obviously depending on their level of healing is when these are involved, but I will address their posture with these exercises at some point in their therapy. It is super important in order to help allow the shoulder to move in a more normal pattern, to have that base set up the way it needs to be. So that is one reason why I really like these exercises. I do also include them for neck problems for a similar reason. We want to make sure that we're moving correctly below the neck when we have problems in our neck, in order to allow a more normalized movement through our neck. So these are pretty common exercises that I give. Usually gave more in an outpatient setting. Now I work in home health, so I have a lot more deconditioning and balance that I work with at this point. But again, these are good exercises, so I just wanted to make sure I share and give a little idea of how to do each exercise. These bands, they're always going to be color-coded. You will find different colors depending on the brand. On a traditional level, it goes yellow, red, green, blue, and black. I don't have my red anywhere around. For these exercises, I am going to show the blue for a couple of them where I'm a little bit stronger, and the green for another one where I'm not as strong. The yellow is, I really recommend that you always start with the easiest, which is yellow. More to make sure you're doing the movement correctly before you start doing it on a regular basis, because you want to make sure that you have the performance before you try and increase the resistance. So if I'm doing something like popping my shoulders up when I'm doing these, then I'm going to completely defeat the purpose of postural strengthening, because the strengthening needs to correct some of those movements. So this first exercise that I'm doing, this is going to be targeting both my latissimus dorsi, also called our lats. It is also a little bit of postural abdominal core strength, and there is going to be a little bit going in my lower trap, because I'm going to be doing a little bit of shoulder scapular depression, which basically means I'm keeping my shoulder blades down. So I'm going to show you in this direction, and then I'm going to show you also what I want as far as in my shoulder blades goes. So usually I will do it further out so that my arms start up here. Unfortunately, again, because I've got kind of a difficult viewing area, I'm going to be doing it from here. I can make these a little bit harder as far as giving myself the right resistance level by going down into a kneeling position. If you've watched any of my videos previously, you know that I do talk a lot about how we can change our position for balance, as well as to make things easier and harder. This isn't necessarily a difficult balance position for me, because I do still have about as wide of a base of support as I did with my feet on the ground. However, if I bring my feet together, then it becomes a little bit more challenging to my balance. So then I can get a little bit more core exercise. So anytime I put any component of balance into an exercise, I have to maintain my core strength and core stability in order to keep that movement solid. So basically my core muscles, which are in my stomach and my back and my glutes, are keeping my body stable to allow my shoulder to move without a compensation and without excess movement through the rest of my body. Okay. Another way I can make it slightly harder is I can go into a kind of half kneeling. I have one foot almost directly in front of my knee as far as the parallel line. Again, requires a little bit more balance because I don't have that same base that I had previously. I can bring my foot all the way here, go up on my toes in the back. This is going to be about as challenging as I can get in a kneeling position. If I'm really feeling ambitious, I can try it with one leg up. So, that's my bad knee. Again, you can make it as easy or hard as you like. So my typical position that I'll do it in is a standing position. My feet are spread apart. If I want a little bit of a challenge, I will put my feet together. That gives me a little bit less security as far as having that wide base. Then if I want to make it more challenging, I can go up on my toes so that all my weight's on one foot. Most challenging is obviously going to be a single leg. If I really want to push it from there, I can do them in a half squat position. And I have done quite often, I like to combine my upper and lower body. So I will very often do a squat position while I do these. Right now, that's not very comfortable on my right knee. My left knee is holding most of my weight, so it becomes not so comfortable on my left knee. So that's part of the reason that wasn't one of the first ones I would show you. So the movement itself is my shoulder pulling down back to my side. I don't need to go behind my hip. All I need to come is to my hip. If it's so easy and so light, which if I used my yellow it would have been, that I can go easily behind my hip without any pain or discomfort, then that's a sign that I should increase the resistance, because really I want it to be a challenge to go down to here. Okay. And as far as in my shoulder blades, what I really want to see is shoulder blades pulled together and down, and squeeze them down and back throughout the movement and keep them down on the way up. I don't want my shoulders to pop up every time. I really want to make sure I'm concentrating on that good shoulder blade position. So here's the base of my shoulder blade. I just pulled it down a little bit. Now I'm keeping it here. And I'm keeping it down as I come back up. If it pops up to here, then I've lost that postural component that I'm really seeking with this particular exercise, which again is really what me as a therapist, I'm going to be looking for every time I have one of my patients do this exercise, because I'm having them do it so that, again, we can create that good, strong base for the rest of our movements, depending on what our issues really are. Very often you don't have spine problems in the thoracic spine. You will have kyphosis, which is where there's excess bend in the upper spine, but it doesn't typically cause pain. You can get a compression fracture up there, very uncomfortable, very painful. Nothing that we can really do for therapy that's going to make it any better. You basically just ice it and wait for it to heal. So typically, while I'm working on strengthening these muscles throughout my thoracic spine, I very often am not actually focusing on the thoracic spine as far as a place of injury. I'm focusing on it as part of postural correction and stability to give me a better base for my other exercises. You can have problems in the shoulder blades. Your rhomboids can become very loose. You can have adhesions and other problems throughout the shoulder blade area. Traps especially can be very problematic. Again, these are areas where you might have pain. Quite often they are as a result of something else. So anyway, the next one that I like to do for all of my patients is a good old-fashioned row. So with a row, I usually do both of these together. Again, these are a little long, so I'm just going to wrap them in so I can get it. So I want them to start out, my arms should be in front of me, my elbows should be pointed towards my rib cage, okay? Thumbs are facing up. I'm pulling back and squeezing through my shoulder blades. Again, what I don't want is this, so I'm not coming up. That's definitely not the right exercise. I want to come more back. What I always ask for my patients is that they're brushing their elbows and the inside of their arms against the rib cage. So that's where you really want to aim. You don't want to be doing this because that's more of a tricep, and it becomes also very similar to the lat pull down that we just did. We want to really make sure that we're focusing on those shoulder blade muscles. I'll also ask my patients to imagine that you're squeezing a shoulder or a pencil between your shoulder blades. So that's the movement that I'm looking for. My arms are coming along for the ride. My shoulder blades are going to center the movement. And I'm really squeezing those muscles back there. Okay. So again, the back view, my shoulder blades are squeezing together as I'm pulling. I don't want them coming up. I want them to stay down and pulled back. Sometimes, depending on what the issue is, I might do some rotation exercises. Really, really, really depends. Sometimes I really don't like rotation through the spine because if you have any instability in your lower spine, or really anywhere, but especially your lower spine, it can irritate it. So I'm not going to do those today just because I don't necessarily see them as a postural exercise, more as just a general abdominal strengthening. But those are the two really, really big ones. I am going to show one more that is kind of a cross between a posture and specifically rotator cuff exercise that I like to do. I have a looped band. This, even though this is one of my easiest bands, is actually fairly difficult. So it is going to be hard for me to get a correct position on this. Bear that in mind. I will do my absolute best. So for this exercise, coming closer to the wall, easier. Farther from the wall, harder. Again, this position here is getting a little bit of core because I have to kind of hold myself in this position. No matter where I am, I want to make sure that my shoulder and my elbow are roughly in line. So I don't want my shoulder to be above my elbow, but I also don't want it way up here. So I want to be just about in line with my shoulder. Okay. The movement itself, I'm going to push one hand into the wall while the other arm is coming back, squeezing my shoulder blade together. So back, shoulder blade together. This one works both sides because the side that is sitting still is working to stabilize against the movement, whereas the side that's moving is actively pulling. So you get a lot of strengthening and pulling through those muscles themselves. So the back view of this exercise is like this. Really making sure that movement comes through the back of the shoulder blade. Posture, in addition to my strengthening, I do want to make sure that I'm always adding stretches. With the stretches, again, it's dependent on what exactly my patient is having issues with. If I notice that I have a patient that has a very kyphotic and forward head position, so I can't show the kyphotic because I've got the metal bars, but the kyphosis is basically just your hunchback is an extreme kyphosis. So extra curvature of that upper spine. The forward head position is this. So where my head is kind of forward of my body position, that is a very common, and again, as we get older, we get more and more like this, and we get kind of hunched over, and it all kind of goes forward. And that position is something that I do try and focus on fixing as possible. One thing that I will do, and I will use often a wall to help. So I will use the wall to help them kind of push into this position. So if I have this forward head position, even though my entire back and shoulders is on the wall, my head is not touching the wall. So an ideal posture, I should have the back of my head touching the wall as well as my upper back. So my normal posture is not quite there. So that means my normal position is a slightly forward head position as well. So with somebody with a very extreme forward head, this is actually really almost a stretch in and of itself. This can be very uncomfortable and difficult to achieve. And even if you don't have a forward head position, it's a good exercise to do to help, again, work on strengthening those those muscles back there. So what I'm looking for this is imagine somebody pushing me straight back from my chin. So from here, straight back towards the wall. I'm not tucking my chin. This isn't what I want. I'm not tilting my chin up. So I will often see people do this, and sure, your head touches the wall, but that's not what I'm looking for. I'm looking for more of the base of the head pushing through their chin straight back. You can use a pillow or a rolled up paper towel to kind of push into. That gives you a little bit more of a tactile sensation, a little bit of resistance. That's a good way to kind of add a little method of strength to it. Usually I will have somebody hold that position for 3 to 5 seconds because this is one of our endurance muscles that we really want to have able to maintain and hold that position for a prolonged period. So that particular head back position, I want them to at least hold for 3 to 5 seconds. I will also talk to them about trying to fix it in their everyday life and be more aware of it, because really posture is 24/7. And as you become more and more aware of your posture, then you can fix it. And if you start by just fixing it 5 times a day for 2 seconds at a time while you're actually thinking about it, over time it becomes longer and longer and more consistent. The other stretch that I like to do is for our pectoral muscles. So pecs are straight in the front here. There are pec major and pec minor, and pec major is a very large muscle, so really I like to do a few different positions in order to get it. I typically will use a doorway, and this is actually called the doorway stretch when you do both arms. My arms are short enough that most doorways, if I do this, I don't get the whole of my forearm on the door. So I usually will do one side and then the other. I'm using my 2x6 right now because it is flat enough that I can get my whole forearm onto the piece of wood to give me resistance. So what I'm doing is I'm stepping forward with my, it doesn't really matter which leg I use, while my arm stays against that wood behind me. So the position, the stretch, I'm basically moving my arm like that, using the door to help keep it there and my step to bring me forward. I want to make sure that I'm not letting my shoulder pop up. I'm keeping my shoulder blade down. I'm only going as far as I comfortably can. I feel a nice stretch through here. Depending on where you're tightest is usually where you're going to feel it first. Sometimes people feel it in different spots. You can do this up more and then you get more along, well for me, I get more along these lower fibers here. Again, it's a large muscle. There's quite a few fibers, so sometimes you're going to get more of a stretch in one area than another if you vary the way that you're doing it. I can do it with my elbow kind of down. For me, I don't get really a stretch so much as I feel like the joint is kind of hitting its end range. Another way that people will often stretch is this kind of open chest, hand down to the side. This one is easier with a full doorway because right now I don't really have half my hand on anything. But again, you know, you can kind of get a little bit of stretch in a different area of the muscles. The other stretch that I like to do is for our neck. I like to stretch my head to the side. So the position is ear to shoulder. My hand is going over top of my head. I am not actually pulling because I don't want to dislocate anything. All I'm doing is using the weight of my arm to give a little extra stretch. What I usually do with this is I will sit in a chair while I'm doing this stretch. This arm will come underneath my buttocks and I will sit on that arm because then I can get a nice little stretch through my upper traps by stretching that lower part by sitting on my arm. Again, sitting on a chair, ear to shoulder, weight of my arm. If you're not 100% positive about this, or if you get enough of a stretch just by this position, then go ahead and stay in that position. This just gives me a little bit of extra stretch. That is really a stretch from my upper traps here, from the neck and down through the sides. You will get a little bit of scalines involved in that as well. Next, I like to do a stretch for a muscle that's kind of in the back of my neck and to my shoulder. It's called levator scapula. So this one, what we're working on doing is we kind of turn our head towards our armpit and then bring our head down to our armpit. Again, I will sit on the hand that is opposite the side I'm moving my head towards. And sometimes I'll give a little extra stretch by putting my hand along the back of my head here. Again, that hand is not actively pulling, it's more just the weight of my arm. Gives a little stretch in there. Okay? So I usually turn my head first, bring my hand or my nose towards my armpit after, and then I'll bring my hand up to give a little extra stretch if I need it. So anytime I do a stretch, I should be holding it for 30 seconds in order to get the most out of the muscle stretching. I will typically tell people to try and do 3 sets, 30 seconds each. You can do less, but there was, at least when I was in school, the research said that 30 seconds was the optimal amount of time in order to get a long-lasting stretch and really make a physiological change to the muscle in order to strengthen or lengthen the muscle itself. So I go with 30 seconds. I have seen 10, 15 seconds suggested. Personally, I do 30. That was not 30 seconds, by the way, if you were counting. And I will say 30 seconds is a lot longer than we think it is. So anything that I do that is timed, that I really want to make sure I'm doing it for the correct amount of time, I will use a timer either on my watch or on my phone in order to make sure that I have the correct amount of time. So those are 2 exercises and a couple of stretches that I like to do for my postural awareness, postural strengthening, postural stretches. So I hope those helped and made some sense to you. And any questions, feel free to ask. I will hopefully later this week, possibly by the late weekend, my next exercises I'm going to talk about are going to be some rotator cuff exercises. So I hope that you enjoy. Thank you.